Hi everyone, Suzanne Ullman here, heart failure nurse in San Antonio, Texas, originally from Nebraska, where the N does not stand for knowledge. I realize that I look like a cross between Kid Rock and Axl Rose, and I'm completely okay with it because there are a lot of people that are a little bit out of their minds right now. And if this is how my neurosis manifests, it feels fairly safe for my neighbors who did see me in the garden like this earlier today, and they both laughed. And they don't know the N for knowledge joke, and I love them for it. Okay, a couple things we need to talk about. First of all, let's just do a review of this last week. Number one, get your medications refilled, ask for a 90-day supply. Number two, postpone all elective procedures. This means annual screenings from mammograms to, if you have a heart problem, echocardiograms. Absolutely no plastic surgeries allowed. No tummy tucks, no breast enhancement, no butt enhancement. Call it off. Okay, the hospitals need to do other more important things right now, and I realize a lot of my audience is just pining to get the butt enhancement. I'm talking to you, Mom. Just kidding. That's a joke. Thirdly, just a quick thanks to all my friends who are giving me tips about, for instance, looking at my audience, which you would not believe how hard that is to do. And number two, about the lighting. I've tried to not have as much backlighting and get a little front lighting. I'm feeling like I am the next Scorsese. Watch out, Irishman, Frank Sheeran story. Okay, so med refills, postpone elective procedures. If you have an upcoming appointment with your doctor and you want to keep it, you can do it all over the phone. Medicare and other insurances are covering it, okay? So no need to enhance your risk of contracting the coronavirus by leaving your house or going into a medical area. Okay, number four, the difference between coronavirus, COVID-19, which is when you test positive for coronavirus, then you have COVID-19, which is the disease that it causes, and then COVID-19 pneumonia, which is the progression of the disease that's causing the most trouble. Remember, pneumonia, inflammation of the lung cells, the alveoli that fill with fluid and then make it really hard to breathe and make you maybe need to be on a ventilator, okay? The newest thing that I want to advise everyone is if you have mild symptoms, please do not assume that you should be first in line to be tested, okay? They really want people to come in that are having severe symptoms, as in shortness of breath and high fever. Those are the people that need to get to the hospital and probably are going to end up needing extra care, though we can't predict that they will turn into pneumonia. But if you have mild symptoms, like you would have with the flu or a bad cold, stay home. Quarantine yourself. Do symptom care, such as, oops, that was my piano. Yes, I'm sitting at the piano. Do symptom care, as in teas, soups, Dayquil, NyQuil, Tylenol, not ibuprofen. No ibuprofen for this, okay? There is some actual data that suggests that ibuprofen can make you feel worse and somehow enhance the bad response your immune system has, okay? I'm sorry there are no pets today, but they have it written in their contract that they have weekends off, and it is Saturday, okay? If anyone has any questions, post them. I love trying to answer questions. Tomorrow, I'm going to share with you a song that I've made up that is titled, I'm Putting on My Sweatpants. It's a song I made up for myself when I started working remotely from home, and I think it could help all of us because there is a rite of passage to realizing you have to be home and you have to be comfortable, and when you put your sweatpants on, I'll give you a little clue, you can get on with your life. All right. Happy greetings, namaste to everybody. Try to keep your feet on the ground, okay? There's a difference between anxiety and fear. Anxiety means you're worried and on edge because bad things or nerve-inducing things are happening. Fear means that you believe that everything is going to just end and explode all at once, and that doesn't have to happen. It's within us to manage that, okay? We're with each other.